Section 18, subsection 1A of the Delta State Contributory Health Commission Law of December 2019 took significant steps to ensure individuals with disabilities access quality health care. In the Equity Health Plan, the law recognized the vulnerable as pregnant women, children under 5, the elderly over 65 years, the physically and mentally challenged, the less privileged, and others. In line with the provisions of this law, and in recognition of the unique challenges faced by persons with disabilities and other vulnerable persons, particularly their often subjection to social stigma, discrimination, and limited access to essential services, the Director General and Chief Executive Officer of the Delta State Contributory Health Commission, Dr. Isaac Akpoveta, continued to advocate inclusive health care and take decisive actions to improve the quality of life for persons with disabilities in the state. In furtherance of his commitment to ensure persons with disability receive quality healthcare services and be protected from financial hazards of high cost of medical care, Dr. Akpoveta took a bold step to adopt and purchase health insurance for 250 persons with disability drawn from the 25 local government areas of the state.
Great Jonapi.
Grace.
Great Jonapi.
Grace.
Greatest of greatest Jonapi.
Grace.
Great Big Bim.
Grace.
Big Bim. Therefore, I, Olorogun Dr. Isaac Akpoveta, as a high net worth individual, hereby adopt and pay for 10 PWD from each local government of the 25 local governments, totaling 250 PWD to receive quality health care so that they can be protected from financial hazard of high cost medical care. Please inform your members across the state and send their details in as soon as possible for inclusion into the scheme. I encourage you all to engage in open and honest dialogue, share your experiences, and offer insights that will guide us in our effort to build a more inclusive society. Don't see your disability as a barrier but a challenge to excel.
He intimated the group of the various policies and programs implemented by the Commission to ensure financial burdens do not hinder the access to necessary treatment and therapies, including the Indigent Enrollee Adoption Initiative, and called on well-meaning residents to adopt and purchase health insurance cards for vulnerable persons, even as he commended the support of the State Governor, Right Honorable Sheriff Oborowori, in providing more access to health care.
We have implemented policies and programs that aim to address the unique healthcare needs of the vulnerable, while ensuring that financial burdens do not hinder the access to necessary treatment and therapies. Through initiatives like the Indigent Enrollee Adoption Initiative, Artisan Enrollee Inducement Initiative, and TSHIP, that is Tertiary Institution Social Health Insurance Program for students, the Delta State Health Insurance Commission strives to break down barriers and create a more inclusive healthcare system that caters for the diverse needs of our people. Hence the Indigent Enrollee Adoption Initiative, by which we call upon people of means to adopt and purchase health insurance cards for vulnerable residents of Delta State. I'm glad that sons and daughters of the state have heeded so to my clarion call and have adopted many indigent persons and enrolled them into the scheme. We are grateful to them. On the part of government, the more agenda of Governor Sheriff Oborowori administration through the equity plan of the commission has enrolled, treated, and paid for over 1.7 million pregnant women and children under 5 years of age. This is remarkable and first of its kind in the country. Thanks to His Excellency, Right Honorable Sheriff Oborowori, the Executive Governor of Delta State. Today, as we dialogue with the representative of PWD, let us reaffirm our commitment to advocating for the rights and dignity of people living with disabilities. Let us work together to remove obstacles, promote accessibility, and empower individuals to live their lives to the fullest.
The leader of the delegation and chairman of the Joint National Association of Persons with Disability, Comrade Ibuza, had earlier appealed to the commissioner to provide a soft landing for their members to enable them receive healthcare without any form of hitch.
As a passionate DJ and as a father, we felt there should be an engagement. The government is our father. There is no way you will take our matter to him that he will step it down. And your humanitarian services have spoken well for itself. And we believe and we are very confident that there is no way we will come to you for succor that you will not listen to us, a father whom you are. Health scheme is a soft landing for the community of persons with disability, coupled with the policy setting up the contributory health scheme. So, sir, we are here to appeal to your honorable self, to look inward, to look into the health of persons with disabilities. Yes, we have peculiar challenges. If we can get attention from any of these designated central hospitals across the state, that when our people are sick or they are down, we can give them an authorization, they will go there and they will be attended to, so that we can be healthy and be useful to ourselves, the community and Delta State at large.
The visit took a new twist when some directors of the commission, in support of the efforts of the DG, adopted and paid health insurance for persons living with disability. The Director of Administration and Human Resources, Comrade Martin Bolum, adopted and paid health insurance for 10 persons. Director of Finance and Investment, Mr. Henry Edozie, paid for 10 persons, while the Director for Legal Services, Richard Nabere, paid for 5 persons with disability. Eunice Emeazia reporting.